Ready?
Go.
Okay. Knock, knock. Hey, Mr. Smith, my name is Shelley. I'm going to be your nurse today. Has the doctor talked with you about us going to put an NG tube in your nose? Okay, he has? Great. Do you have any questions? No? Okay, can you tell me your name and date of birth? Okay. Well, since you don't have any questions, we're going to get started. I'm going to pick your head up really high. Have you had a tube before? No. Well, I'm going to put this tube in your nose, and it's going to go down to your stomach. It should make you feel better. It might not be comfortable to start with, but if you start having any discomfort, if you'll just raise your hand and let me know, that way I will stop. Let's see. I'll tear my tape. Okay, I'm going to give you an emesis basin. I'm going to give you a cup of water. When I tell you to sip, I really need you to swallow for me. I'm going to give you a tissue in case you need it if your eyes start to water. Put this over your chest. This may make you feel like you have to throw up, but I hope not. Okay. Can you tell me, can you breathe in? Breathe in. I think this side is the best, so we're going to put it in the right side. Put that a little bit. From your nose to the tip of your ear, down to your xiphoid process. And I'm going to tape it, so I'll know how far to put it in. Okay. I've got the vent closed. I'm going to put my lube on it. I'm going to have my test strip ready. Okay. I'll have you hold your head back for me. Okay. Going to go in toward the ear. Twist it. I feel it slip past that bone. And swallow, 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 swallow. Okay, I'm all the way down to the tape. Are you all right, Mr. Smith? Another pair of pants. Oh, I ripped them again. Third time's a charm. Got my pants torn. Put it across the bridge of the nose. I'm going to wrap it around one way. And I'm going to wrap it around the other way. I'll put a piece across the bridge of the nose. And I'm going to check the placement of it. I'm going to take my syringe. clamp it, put air in it. I heard a bloop. I'm going to pull back, get some gastric content, clamp it. Going to test it on my paper. The pH is less than 4, so I know I'm in the stomach. Whatever extra I have, I'm going to put it back in, and I'm going to clamp it. I'm going to put a piece of tape on it and a safety pin if I've got it, and I'm going to secure it to the patient's gown. Okay, Mr. Smith, we've got it in. I'm going to call X-ray and then have them to come and do a X-ray to be sure we've got it in the right place. I'm going to clean up my mess. I'm going to leave his head of the bed up. I'm going to do mouth care on him because he may have an unpleasant taste in his mouth due to the KY jelly, or in case he's had any emesis. I'm going to put my side rail up. I'm going to put my bed down, and I'm going to put my call light in reach and remove my privacy. And wash my hands and then document. Now to take it out, I would have the doctor's order, and I would have sterile water, and I would draw up, I would do my AWOPs, but I would draw up about 20 to 30 of my sterile water, clamp it, flush it with sterile water, clamp it. I'm going to flush it with air. I'm going to untape it. I'm going to be sure he has bowel sounds before I take this out. I'm going to untape it from his nose. Okay, on the count of 3. 1, 2, 3. I'm going to remove it. I'm going to put this in the trash. I'm going to do mouth care. I'm going to document, and I'm going to be sure to come back in and continue to check his bowel sounds to be sure that he has good peristalsis. And again, all my safety precautions. And that's it.